Hi, me again. Now today's session is about maintenance. It's about keeping these electrodes secured on the acupuncture points, the Jing-Well points of the feet and the hands. Now the feet and different parts of the body, even the hand and so on, and they're easy to keep the electrodes on for several days. But the fingers, the Jing-Well points on the fingers, they end up falling off in a day or two, and no big deal. All you have to do is notice. First of all, you'll notice the pain returning. Maybe not as bad, but it starts to return. And often when I see clients complaining of pain again, I look at their fingers. They've been using Bioelectrode Therapy, and I see some of the electrodes are not on, and therefore they've lost that microcurrent connection, and therefore that electrical field is no longer stimulating the cells, the diseased cells and tissues, and you lose all that healing rush, that phenomenon. Electrolyte, pH balancing, mitochondria stimulation, nitric oxide, all that healing stuff. So all you have to do is notice it and then just clean it with an alcohol swab, and then just reapply whatever it is, the copper or the silver electrodes. Right now I'm preferring copper to silver, copper and silver, as opposed to gold and silver. Gold and silver does work, but it's not as strong. So right now I promote copper and silver. Now, it doesn't matter if they come off, and even for a day or so, but you will get that return of pain and discomfort. So it's the continuous day and night, overnight 24-hour stimulus of the electrical field that does the rapid and comprehensive healing. So just keep that in mind, and don't complain about keeping the electrodes on. It's so quick and so easy, especially with the Bioelectrode Therapy kit, where you've got the polyurethane patches and the stir stick applicators and your electrodes right there. So it's really quite simple. So not a big deal, and well worth the effort. Things like systemic conditions like opioid withdrawal, Fibromyalgia, and all these other diseases, even cancer, for example, where you've got potential for metastasizing. So you want to treat every cell, every tissue. Therefore, we want to do all the points on the fingers, one hand, one foot on the other side, or both hands and both feet. And you get a comprehensive systemic stimulation by the electrical field. And that's what heals our biofield. And harmonizing, it's just basically, clearing that disruption in your own, what we call endogenous energy field. So that's the magic of bioelectrode therapy, and pretty much a wrap. No big deal, just reapply, and away you go. Pain will be relieved. And for things like these systemic conditions, for chronic diseases, it might take a week, might take a month. Well, for people who use opioids, I would recommend continuous treatment over a month, and then for post-acute withdrawal, periodic use, or even continuous use. And it will help you with that anxiety and sleeping and craving and, all that kind of stuff. So it's the whole meal deal in a very simple, remarkably effective therapy. So overcome your skepticism. I mean, I deal with skeptics all the time, but sometimes people are, they just don't want to believe, or whatever it is. I don't know what it is. And, but anyway, so overcome your skepticism and be curious, and just be open to a new challenge, a new way of treating addictions, a new way of treating complex pain problems. Think outside the box. Again, thinking inside the box, doing the same old thing every day, you're going to get the same old results. And right now in the field of addiction, it's just simply not working. This crisis, this plague, is exponentially worsening. And we need to create this barefoot doctor's army. And I'm enlisting right now. I'm enlisting people who are interested in learning a very simple therapy, learning it and doing it for yourself, doing it for your family, friends, associates. You can make a business out of it. You can use it anywhere, any place, in the world. And so that's pretty much a wrap. And yeah, have a good day. Stay well. Thank you.